This is the Fertility Friday podcast, episode number 41. Welcome to the 41st episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been enjoying the show, I'd love it if you would take a moment and leave a review and a rating on iTunes. Of course, it helps the show to move up in rankings so that more people can find it. And I'd like to say a very special thank you to all the listeners who've left reviews already. I read all of your reviews and I appreciate you taking the time to let me know how I'm doing. And of course, if you enjoyed today's episode, please stop by the show notes page and leave a comment. You'll find all the episodes at fertilityfriday.com/podcast. You can find me on Facebook at facebook.com/fertilityfridays with an S, and you can also find me on Twitter at Fertile Friday. And as many of you know, I recently created the Fertility Friday Facebook group. So just go to fertilityfriday.com/community and you'll be redirected to the group. And of course, my plan with the group is to create a safe space for like-minded women who are wanting to learn about the fertility awareness method and support each other. And in today's episode, I'm really excited to be joined by Dr. Maureen Rozenn. Dr. Rozenn has practiced integrative medicine for over 15 years. She's a doctor of acupuncture and oriental medicine with dual specializations in women's health and pain management. She teaches classes to master's and doctoral students on how to treat women's health and fertility issues, and she's recently authored the book Your Fertility Program, geared towards helping patients navigate the confusing field of infertility. And in today's episode, we'll be talking about the important role that thyroid health and adrenal health play in fertility, the important role that having healthy menstrual cycles plays in fertility, and also the way that the Oriental medicine perspective differs from the Western medical perspective. So without further ado, welcome to the show, Dr. Rozenn.
Oh, thank you. It's lovely to be here.
Oh, thanks so much for coming on the show. And so I did give you a bit of an introduction, but I know you've done quite a bit in your career. So I'd love for you to fill in the blanks a little bit and tell the audience what brought you into the work that you do now.
Sure. Thank you. Well, when I was doing my bachelor's work, I was told by a friend that I should try acupuncture for some health problems that Western medicine couldn't help me with. And I would never have tried it if a friend didn't encourage me to do it. Because it sounded pretty weird 25 years ago. It was. But I thought, okay, I was actually an herbalist at that time. I had been practicing herbs for maybe 5 years, and that was a big part of my life. And I thought, okay, I'll try it. And so I did. And needless to say, it really moved me. That experience was really powerful for me. And I could go on and on about all of the ways that it influenced my life and the way that I think, and my perspective. But suffice it to say, I knew after I got my bachelor's that I wanted to practice Chinese medicine and that I wanted to focus on women's health. And so at that time, I just done my bachelor's. I thought, okay, I could move anywhere that I want. I even looked at a school in England. But Santa Cruz had what I felt was the strongest women's health care program. And so I came to Santa Cruz, and like many people who come to Santa Cruz, I never left. And so here I am 20 years later. And it's a subject that I've always felt passionate about because I feel that in my own experience, Oriental medicine can speak to women's health problems in a way that Western medicine can lack, because Oriental medicine is process-oriented. And women's hormonal cycles, the endocrine system, in essence, the menstrual cycle is a process. It's not an event. Mm-hmm. And by tuning into the fertility and awareness method, I think that's what people learn is, oh, I just don't bleed every month and that's boom, what happens, this event. It's a process from start to finish. And so I think that Oriental medicine can really offer women an interesting perspective and a higher degree of healthcare than they can get from other perspectives.
Mm-hmm. Well, I was in preparation for our interview today, I was reading your book and I noticed that you had an entire chapter on the fertility awareness
That's
method.
right.
So maybe before we get into discussing thyroid and adrenal health, maybe you could tell us a little bit about how you came across the fertility awareness method and how helping women to understand their menstrual cycles with the fertility awareness method has kind of informed and changed your own practice.
That's a great question. And I honestly wouldn't know where to start in, in terms of when I encountered the fertility awareness method. Probably I first learned about it from my Chinese gynecology teacher at Five Branches University, the late Sharon Feng. She was an MD from China who came here and practiced and taught for many, many years. And I was really surprised that when I went to China as part of my doctoral studies, in China, in the hospitals, in the gynecology hospitals, it is expected that you chart your cycle. Everybody charts their cycle in the gynecology hospital that I was studying at in Guangzhou. And so whether you were being seen for endometriosis, you were being seen for infertility, you were being seen for even perimenopause, you would bring your chart. And it was really incorporated. Their method of healthcare is just so interesting. But one of the facets of it is that you would bring your chart with you to every appointment. So you kept your own medical records. And so there was this onus on the patient to know what their medical records said and provide it, carry it around, and be responsible for it. And you'd bring the physician your medical records and you would bring them your charts for at least the last month, if not the last several months. And they would make you an herbal formula for that week based on, in part, your BBT.
Wow.
So I think that that was the point that it really struck me how integrated basal body temperature charting, at least. One of the physicians there, one of the gynecologists there, actually gave me a thermometer. It's in Celsius. This is from China, and the rest of the world uses Celsius, and it's one of my prized possessions. But anyway, it was at that point that I really began to understand how the fertility awareness method was integrated in modern China and could be integrated in Oriental medicine.
That's fascinating. I think you just blew my mind a little bit. That's really interesting that it's just the thing that you do where you
You
were
just,
studying.
yeah, there are no questions. It was just expected. So it was very, very interesting.
And how have you found kind of applying that same practice to your own work with patients? How does that help you? I guess how does it help you help them better?
Mhm. Well, the more that the patient knows about themselves and their cycle, the more able I am to help them. So the more knowledgeable they are, I could use the word empowered. The more empowered they are to understand what's happening with their own body, the better I can help them get pregnant. And so that's the perspective upon which I come to this subject with patients. And I also have a great deal of room. So, of course, the fertility awareness method has several pieces to it. It's basal body temperature charting, it's cervical position, it's cervical fluid, um, and there are many different symptoms and aspects of your health that you can chart, that you can pay attention to. It's really helpful to know because, of course, you can use an LH, a luteinizing hormone, urine stick, so an ovulation detector, and you can buy them at just about anywhere online or um, any drugstore. And of course, you urinate on the stick, and it gives you this indication that tells you loosely if you're ovulating. But all it's saying is, okay, the pituitary is telling your ovaries to ovulate. It doesn't tell you if that's actually happening. So it's a prospective test in that those ovulation detectors will tell you if your pituitary told your ovary to ovulate, but it doesn't tell you if you did ovulate. Well, I find the most reliable way to see when and if you did ovulate is basal body temperature charting. And
Mm-hmm.
so when I explain that to patients, their ears really perk up. Some people feel overwhelmed by the thought of taking their temperature every day. They feel that it's a constant reminder that they're not pregnant. They feel um, it just is not, maybe they don't get constant sleep. Maybe they wake up every 2 hours, or they don't wake up at the same time every day, or they have some obstacle that keeps basal body temperature charting from being something that they regularly do or feel that they can do. Then I get creative and we use other aspects of the fertility awareness method, like we really focus on cervical fluid or cervical position. Um, but that differentiation between the pituitary's instruction to the ovary to ovulate and whether or not the ovary actually did it is a really important distinction that I think it's really important for women to know, um, so that they can understand their fertility and that they can get pregnant.
Mm-hmm. Yeah, the conversation about ovulation predictor kits is always an interesting one because, uh, from the perspective of someone who's charted their cycles for a really long time, I kind of think of it as, in my case, I kind of think of it as not useless, but not as helpful as just charting. But from, many women, of course, appreciate having the ability to test those things, maybe not fully understanding that it's no guarantee that you have ovulated. It's testing for, like you said, a sign that you could ovulate.
Exactly. And that's a really important differentiation in understanding when the pituitary puts out that hormone and when the ovary responds to it and what that interval is and how long the egg is viable for and how often someone should have intercourse and when they should have intercourse in the cycle. Some women wait until they get a positive LH surge or a positive urine test.
Mm-hmm. And that can be too late, depending on if the cervical mucus is, if you missed
You
your,
might have missed your window.
yeah.
Exactly. So, anyway, I'm not sure if that answered your question, but that's, yeah.
No, absolutely. It's really interesting. And I love talking to health practitioners and doctors who incorporate the fertility awareness method and incorporate that knowledge of the menstrual cycle into their practice. Of course, when it relates to fertility, because it just gives you an additional tool that's invaluable to know what's going on.
It comes back to process versus event. The BBT and the fertility awareness method as a whole enable someone to look at the menstrual cycle as a process, whereas an LH surge is an event. A
Mm,
period is an event. An ovulation is an event. In Oriental medicine, we just don't see it that way. We see, again, we see the entirety, the cycle, the whole process. So it supports that worldview as well.
mm-hmm. Well, and of course, the menstrual cycle there's a whole hormonal cycle going on in the background. So maybe that can lead us into talking a little bit about the thyroid. Maybe we can start by talking about why is thyroid health important for fertility in general? What does the thyroid have to do with fertility?
That's a really good question. And actually, in my book, I talk about the thyroid as the unsung hero of of the endocrine glands, in that it is so important, but yet we often don't talk about it. And the fact is that if a person has autoimmune thyroid disease, it's important for them to know that if they're endeavoring to get pregnant. It can affect their health and it can affect the health of the fetus, of their child. So it's very important to know the status of your thyroid. When I have patients come in and they haven't had any blood work, a thyroid test, at least one aspect of thyroid function, is always on my agenda for just even an introductory blood work panel, because the thyroid affects every cell, the metabolism of every cell in the entire body. So, of course, if you have an underactive thyroid, which can happen for many reasons, but if you have an underactive thyroid, then you may have difficulty losing weight. You may have constipation. You may feel cold. Um, and that might be autoimmune in nature, and it might not. Um, but because the thyroid affects every cell, of course, it does affect the fetal health, it affects the health of the baby, and that's one reason why it's oh so important in fertility.
Mm-hmm. Oh, and for the listeners who might not be familiar, could you describe, I guess, the difference between autoimmune thyroid and then, I guess, some of the other factors that could cause changes in thyroid?
Sure. So the thyroid is a little gland that sits in your throat, and again, it affects the metabolism of every cell. And sometimes an autoimmune thyroid problems, which can happen for a variety of causes, a person could get an autoimmune problem. That's when the body attacks its own cells. So, in a thyroid autoimmune problem, the body is attacking some aspect of the thyroid. Maybe it's attacking the thyroid hormone, maybe it's attacking the thyroid gland. Uh, some aspect of thyroid function is being affected not by an outside force per se, but by the body's, um, by the immune system. And so that is an autoimmune thyroid condition. And there are different types. Graves' disease is one common autoimmune thyroid problem. Hashimoto's thyroiditis is another common one. But there are other antibodies. There are a variety of antibodies that an antibody is a response by the immune system to a cell. So a thyroid antibody is, again, the response of the immune system to a thyroid cell. So there are many different types of thyroid antibodies one can make. Other reasons that the thyroid might be functioning suboptimally are just incredibly varied. It could be fatigued adrenals. It could, I mean, they're just it could be a cause of someone, so since we're talking about fertility, suboptimal thyroid functioning could be a cause of infertility, but it could also be an effect of some other issue that's happening in the body.
Hmm.
So it's varied and it's complicated, but the good news is that there are some tests, simple blood tests that your healthcare provider can run to ascertain the general function of your thyroid, and it can be done at any time in your cycle. And as I said, these are tests that I use with every new patient, and they're relatively inexpensive and accessible. So that's the good news.
Mm-hmm. So then the autoimmune thyroid is when your body is attacking some aspect of the thyroid, and that would obviously reduce its ability to function optimally.
Right.
And then there's other causes that can affect the regulation, the hormone regulation of your
Right.
thyroid. And so we've often heard about hypothyroid and hyperthyroid. And so maybe you could talk a little bit about the difference between the two. I know that, hypothyroid, for many years I thought, oh, it just means that your thyroid is functioning a little lower because that's all your doctor will tell you. And then I learned about the autoimmune component and Hashimoto's and how that can actually similar result, but a completely different process that's going on in your body that, like you said, it's important to know about.
That's true. One of the reasons that it's important to know about from a holistic medical perspective is because the two can be treated very differently. So, if you're having thyroid problems from an autoimmune cause, then the root of the issue would be treated. So, I would look at the immune system and how can I help regulate not only thyroid health, but that's really a symptom. The autoimmunity, the attacking of oneself, is more of a primary issue. So I would look at what factors in their diet might be contributing to an autoimmune process. And while diet is very important in just a simple hypothyroid or lower functioning thyroid, there are different dietary recommendations if it's an autoimmune issue or if it's a frank or simple low functioning thyroid issue. So and also the nutritional supplements vary, and also the herbs vary, that everything is different. So in Western medicine, the treatment of low thyroid, if it's from an immune problem or if it's not, is the same, where you would be prescribed by most Western practitioners, you would be prescribed thyroid hormone. And so often, thyroid antibodies are not tested for in the Western paradigm because it doesn't change the treatment. And in holistic medicine, it really changes the treatment. So, and also as you mentioned, you might not get an explanation from your primary care physician, or you might not even. Thyroid tests, there's an art to interpreting as well as a science to interpreting lab work. And thyroid tests are interpreted differently by different healthcare practitioners. And a conservative perspective will see a thyroid test, a person may see a thyroid test and not see a problem with those numbers in that blood test. In other words, they might look at that blood test and say, oh, your thyroid's fine. It's within normal range. So, for example, if you go to a lab and you get your blood drawn and you get TSH, which is called thyroid stimulating hormone, you get that level drawn and it comes back and your number is 4.5. And the lab says that you can have a range of all the way up to 5.5. And that's normal. And so because you're normal, then you're okay. But in fertility, we want that number, thyroid stimulating hormone, TSH, to be 2 or below. So depending on who reads your lab work, you may get different opinions. And depending on who's responsible for ordering your lab work, you may get different labs. Someone may order thyroid antibody tests and another person won't.
Mm-hmm. No, absolutely. And yeah, I find that really interesting. So, because I myself am hypothyroid and I've had some challenges getting my doctor say to do certain tests. And maybe you could talk a little bit about the difference in perspective because you touched on it. You mentioned that regardless of what is the cause, what is the root cause of the thyroid dysfunction, the treatment in Western medicine is the same. And you mentioned that the treatment is thyroid hormone, essentially, but it's often a synthetic hormone that's prescribed. I think Synthroid is generally the go-to. So maybe you could talk a little bit about just about how, from your perspective, from the Chinese medicine perspective, what the treatment options are and how they differ from, I guess, the kind of band-aid, just add more hormone.
That's an interesting question, and one that I get asked in some form or another quite often. Um, so when I say a Western perspective, I'm of course talking in generalities, and I'm talking about Western or allopathic biomedicine. I'm not referring to naturopathic physicians. I'm not referring to homeopaths or other people who may, or Western herbalists, or other people who may identify themselves as Western practitioners per se. And until very recently, the general allopathic Western practitioner perspective on thyroid health was that if you are within the lab ranges for your TSH, which is only one measure of thyroid health, if you're within the normal range, then you're doing okay. And fertility specialists, Western fertility specialists, reproductive endocrinologists, do not think that that's the case. So the consensus is it should be optimal, which is different than normal. Optimal is, again, 2 or below. So it really depends on what Western practitioner requisitions what tests. And people can be frustrated because TSH is one test. Another common test is the endocrine system is amazing in its complexity, and it just can get very complicated for practitioners, not to mention for patients trying to understand their own thyroid health. But I've had patients who've been frustrated that their primary care physician wouldn't order a free T4, so an unbound circulating thyroid hormone. They want to see how much thyroid hormone do I actually have. T3 is another type of thyroid hormone. And they want to see how much T3 do I actually have. And those in holistic medicine, that matters a lot. You may go so far as to order a reverse T3, which is another type of thyroid hormone. And so holistic practitioners think this is important. We look at how thyroid is received by and acted upon by the body, and there are different tests for that. So you won't have much trouble getting a holistic practitioner to order you any thyroid test you want. But because, as I said, because in Western medicine, I hate to use the word traditional, but in allopathic Western medicine, most practitioners use only thyroid stimulating hormone, TSH, as a measure. And if your thyroid stimulating hormone is not within the normal range, you will probably be prescribed a thyroid hormone, which is a synthetic T4. And there's a lot of questions that the holistic practitioner would ask, such as, how is the body interacting with that T4 drug? Is it being absorbed? Is it being acted upon? There are a lot of different measures that we would look at. And in Chinese medicine or Oriental medicine, we would look at we would take it a little bit farther, and we would look at not just the thyroid, but we would look at all of the other endocrine structures and how they're interacting with the thyroid, and ascertain what's the overall balance of the endocrine system, as opposed to simply how is the thyroid doing. A little bit different. There are different types of thyroid hormone combinations. You can get thyroid that comes from pigs, armor thyroid, which is T3 and T4. It's a couple of different thyroid hormones mixed together. And there's really a lot of variation on thyroid prescriptions from a Western perspective, and who's going to give them to you, and in what doses are you going to get them. When I have someone who comes and who wants a thyroid hormone prescription, because thyroid hormone prescriptions are out of my scope of practice, I always have them see either an endocrinologist or a specialized naturopathic physician that I personally know who specializes in hormones specifically, in order to make sure that their thyroid is taken care of, because it is so important to have that thyroid within the optimal range. And that's in addition to what I provide, which is, of course, looking at the thyroid as a part of the Oriental medicine structure and looking at its function in relationship to other organ systems.
Well, and for the listeners many of the listeners are maybe they are not planning to get pregnant tomorrow, but I'm sure many of the listeners are thinking of getting pregnant in the future or trying, or maybe they're having, just recently started charting their cycles and they're noticing, different things that may not be looking like what they do in the books. So when a woman has hypothyroid or hyperthyroid or some variation of thyroid hormone dysregulation, how does that impact her fertility negatively?
That's an interesting question. You asked me earlier about the difference between hypo and hyperthyroid, and I didn't answer. I should be clear. So hypothyroid is when the body doesn't have enough thyroid hormone to do what it needs to do. And the symptoms are those of being cold, being constipated, possibly losing hair, having dry skin, being lethargic. And then on the other hand, hyperthyroid is where you have too much thyroid hormone. And those people tend to run, in contrast, they have difficulty gaining weight as opposed to losing weight. They can have rapid heartbeat, they can have insomnia, they can be very, very anxious. So, both of those extremes, as you can imagine, are going to affect the basal body temperature chart. They're going to affect someone's capacity to get pregnant. And they can be very uncomfortable. It can be very, very uncomfortable to have either an episode of hyperthyroidism or hypothyroidism. And sometimes, especially in autoimmune causes, people can vacillate. They go between hyperthyroidism and hypothyroidism. So if someone thinks that they may have hypothyroid or have hyperthyroid symptoms, it's very wise to go obtain a blood test. It's simple, and sometimes my patients have run into a problem where they wish their physician would order a thyroid panel that would give them maybe 5 or 6 indications of thyroid health rather than simply the thyroid stimulating hormone. And I think there's a lot to be said for ordering a full thyroid workup. But these tests, again, are not very expensive. And if you feel like you're not getting the health care you need from whomever you're seeing, allopathic physician, nurse practitioner, licensed acupuncturist, it's best to seek a second opinion. And you can obtain these blood tests.
Mm-hmm.
I think that you should definitely be tested because, again, it can throw off the menstrual cycle. So people with thyroid problems sometimes don't have a regular menstrual cycle. Perhaps they don't ovulate. And of course, if you're not ovulating, it's going to be challenging to get pregnant.
Naturally. And what are some ways that it can show up in your chart? I mean, one that I can think of right off the bat is that when you're charting your menstrual cycle, if you're charting your basal body temperature, as you mentioned, if a person has hypothyroid, one of the symptoms is that they might feel cold. And you also mentioned that the thyroid hormone is essential in our cell metabolism. And since the basal body temperature is measuring our metabolism, one of the ways that thyroid can show up is by having temperatures that are much lower than the normal range.
That's true, and it's a good point. So it's certainly not the only reason that people have low basal body temperature readings, but it is a common one. So basal body temperature is where, as of course, as you know, you're taking your temperature at the same time right when you wake up in the morning, and the idea is that you're getting your basis, you're getting your static base reading of what your body temperature is, and you're inferring several things from that piece of information. You're inferring how hormones are acting on the temperature center in your brain. So thyroid hormones, because they work on every cell and they're responsible for your metabolism, are going to work on the temperature center in your brain as well. So if you're hypothyroid, maybe your temperatures are hovering around 95.5, and and you can't find a space on your basal body temperature chart for your temperatures because they're too low. um, that's a sign that something may be going on with your thyroid. And again, it's not the only reason to have very low temperatures, but it is a common one. Likewise, with hyperthyroidism, you can have temperatures that are too high. Maybe they're 99. Uh, Maybe they hover way above 98. And they could be erratic. They could be showing that you're not ovulating. But in either respect, from basal body temperature charting, you can get a feeling of what your basic temperature is doing and infer from there what may be happening with your thyroid. So temperatures that are too high consistently or temperatures that are too low consistently would be one of the tip-offs that you should have your thyroid checked.
Mm-hmm. Well, and you mentioned that whenever you have a client who is having fertility challenges, that the thyroid is one of the things that you always check. So, one question I wanted to ask you is how common are thyroid issues? And also, why do you think that is? Why? Because I'm assuming that they're fairly common, but you could talk a little bit about how common you see them in your practice. But why are they so common?
That is a great, great question. So let me think of how to answer that. Sometimes I see thyroid issues and they are subclinical. So what that means is that a person might go in for a blood test and they come back and their thyroid by blood test looks completely normal. But yet they're having symptoms. They're having symptoms of either hyperthyroid or hypothyroid. Well, what's nice, there are different ways to treat this scenario. Uh, in Chinese medicine, I'm able to, through a different medical paradigm, I'm able to ascertain the health of the thyroid. So there are acupuncture points all over the body. Some of them correspond with thyroid health and thyroid function. So I'm able to palpate, I'm able to feel those acupuncture points and look at how the thyroid is interacting with all of the other, because Chinese medicine is a holistic medical system. So in Chinese medicine, we can't just look at, say, the thyroid. We have to look at how all of the organ systems are functioning together. So that gives me a way in that isn't available to Western practitioners. It gives me a way to work with thyroid issues that perhaps don't show up on blood work. Perhaps they show up, a person has thyroid issues, but they're not, their thyroid is still compensating. It's not showing abnormal results. But I would be able to pick that up in my different diagnostics and the way that I look, different paradigm through which I view the body. In terms of why thyroid issues are so common, because they really are, they're more common in women than in men. And one reason is because of environmental issues and environmental toxins. The thyroid is very vulnerable to environmental pollutants. And as my Japanese acupuncture teacher likes to say, all of the fish in the Great Lakes have thyroid tumors. Now, I haven't personally gone and tested all of the fish in the Great Lakes, but I believe her.
Mm-hmm.
Because they're reacting to contaminants in the water.
Mm-hmm.
And so the thyroid is a vulnerable gland that can be affected by environmental contaminants. That's one reason. That's one very, if you might say, one very Western reason. Another reason is The thyroid being in the throat, if you have tension in your neck and in your throat, perhaps even at a level that you're not aware of, you can inhibit circulation to your own thyroid and change thyroid function. I have one patient who actually has diagnosed autoimmune thyroiditis, which is inflammation of the thyroid. She has episodes of hyperthyroid, and well, she used to, I should say. She doesn't anymore. Um, One of the main reasons why she was able to change her health is that she realized how much tension she was holding in her throat. And through treatment, we were really able to get the circulation back to her thyroid. And with diet changes and with supplements and with herbs, we were able to change her patterns of functioning so that she doesn't register with antibodies anymore. And she doesn't have the experiences of hyperthyroidism that she used to have. I treated her not with hormones, but with Oriental medicine principles. So, but not the issue of speaking, either not speaking what's on your mind, holding something back. These are some of the more, well, these are some of the other reasons that maybe a holistic practitioner might look at in terms of thyroid function.
That's I love that example, and it leads me into one of the questions that I wanted to ask you. I think that if you asked a general, a doctor, allopathic medicine doctor, if it was possible for the thyroid to heal or that type of thing in general, I'm guessing the answer you would get is, well, once you go on Synthroid, you're just on it for the rest of your life. So that leads me to my question, which is it possible to heal the thyroid, which I think you partially answered in the last example? And also, I wanted to ask, is it possible to treat thyroid imbalances without medication? So I know you alluded to that in your example, but I'd love for you to talk a little bit about those two ideas.
Sure. So, Synthroid is a drug that's given to people who are diagnosed hypothyroid, so they don't have enough active thyroid hormone in their body. And typically, in the Western allopathic perspective, once you get put on Synthroid or a variation of that drug, thyroid hormone, you don't come off. You're on it for the rest of your life because it's assumed that your thyroid can't function properly. And it's not assumed that that will change. Um, I have seen that change. I have seen that change so many times I can't describe it. And probably by nature of my practice, I have never seen it change without effort on the part of the patient. So ways to change your thyroid health are, number one, someone helping you. So, of course, acupuncture, herbs, supplements, and then ways that you can help yourself. Well, there are a lot of dietary recommendations for thyroid issues. So, um, I made some comments about autoimmune thyroiditis and how the diet would change if someone had autoimmune thyroiditis, and that's true. Something that people don't know is that there are certain types of vegetables that, if you eat them uncooked, can impede thyroid function. So soy products, edamame, if you eat that uncooked, or cruciferous vegetables like broccoli or cauliflower or pine nuts, those can all raw. If they're cooked, they lose this capacity, but if they're eaten raw, they can lower thyroid function. So there are dietary prescriptions that one can undertake to change their thyroid function. But again, people don't come and see me and tell me, oh, I had a thyroid problem and now I don't, and I didn't do anything different.
Mm-hmm.
I don't think I've had that happen once, um, ever. So it does take work, and sometimes people are able to get off of Synthroid or reduce their dose. Sometimes they're not. But I found that even if they're not able to completely get off of thyroid hormone, the other symptoms and their quality of health can improve dramatically, even if they still have to continue to take a little bit of thyroid hormone. So it's not a yes or no, black or white answer. It really does vary on the individual, but yes, I've seen people absolutely get off thyroid hormone.
Well, I think that one of the things that you may be alluding to is the fact that there are people who are on thyroid hormone replacement therapy, but they don't necessarily feel great.
Yes.
And so what you're saying is that, even, well, from, I'm trying to paraphrase what you said, but basically it sounds like what you're saying is that even if you're not able to get off the thyroid hormone, many people actually start feeling great again, even if they still have to take a little bit, which is what the patient wants, to feel good.
Ultimately, I found that really is the core issue, is that people want to feel good, and and they want to do it naturally, and they want to feel like they have some power over their health as opposed to just taking a pill every day. Uh, so this is the gift of Chinese medicine, where we can look at the body as a whole functioning organism rather than zeroing in on the thyroid gland and the thyroid hormone. We can look at various aspects, say the liver. The liver is a really important organ in terms of making thyroid hormone available to the body. Thyroid hormone comes in different forms, and it needs to be converted into a substance that the body can use. And the liver is one of the main places that happens. So perhaps someone is taking thyroid hormone every day, but they still feel tired, they still feel sluggish, their basal body temperature is still not on the chart, and they're not getting pregnant. And what are they to do? So what if someone in that situation would come to me, I would look at them, and one of the first things I would look at is, okay, well, they're taking this hormone, but is it actually being converted in their body into a form that they can use? And so again, we look at not just the thyroid, but we look at the liver. And then if we look at the liver from an Oriental medical perspective, we have to look at the heart and the digestion and all of the other organ systems, as well as the uterus and the brain and the lungs, so that people can, in the case of the fertility patient, so that people can obtain their goals, which is to feel good and to be more fertile and ultimately to get pregnant.
Hmm. Well, and what are the implications or even the examples that you've seen in your work where a woman is having fertility challenges? You do the thyroid panel and you determine that her thyroid isn't functioning optimally. How does actually treating that thyroid issue impact her fertility after it's kind of under control?
Mm. Do you mean under control? Do you mean that her blood work is quote unquote normal?
Well, I guess more of the overall to how would I say this? So when you're working with a patient, what your goals are in terms of not just having labs within normal, but also for her overall to be actually doing better.
Mm. That's a good question. My goals are her goals. So sometimes people come in and they have thyroid issues, and their goal is, I want to get off medication. Then that's my goal. Sometimes people come in with thyroid issues and they want to get pregnant. Then that's my goal. And I might treat those two women very differently depending on their goal. I know that that's uh, a challenging answer, but that's the truth. It really depends on what their goals are. Ultimately, in both scenarios, I want them to obviously obtain their goals and to feel better. So, fertility in the Oriental medical perspective is not, it can't be separated from whole body health and feeling good. So, so that's the underlying theme in either scenario. Does that answer your question?
It does because well, I love your answer that your goals are her goals. Because obviously sometimes you kind of I think many women have had that experience when they're seeing a medical health practitioner of some kind, and you know you're really trying to get whatever. Like I really just want to feel better, but your doctor doesn't. Your doctor's goals can be different to your goals. So that's actually really refreshing to hear you say that. But I guess I was getting at once these like once if a woman's working towards fertility, once she addresses the dysregulation of her thyroid, does that positively impact her fertility? Is that something? I mean, obviously you're looking at her whole health and everything, but I guess the question I'm asking is, how does improving the thyroid impact her fertility?
Okay, that's a really good question. So the endocrine system is this one big balancing act. And so if your thyroid is functioning well, then the other aspects of your endocrine system are going to be functioning well. If your liver can convert the thyroid hormone the way that it should, then it'll probably be able to work with estrogen and other sex hormones the way that it should be able to. And one hormone being out of balance, say thyroid hormone, is going to affect other key fluctuations in thyroid and fertility hormones like follicle stimulating hormone, luteinizing hormone, estrogen, progesterone, testosterone, cortisol. I mean, the list just goes on and on. So once a woman, when someone comes to me, it might be, so say it's a fertility patient, she comes to me and I run blood work for her and I discover that her thyroid needs some help. Chances are, through my diagnostics, my traditional diagnostics, pulse and other Chinese medical diagnostics, I would have discovered that already, but in a different way, in a different language, if you will. So helping her thyroid is going to be a part of my overall treatment of her, which is going to be aimed at helping her be more fertile. And specifically to the thyroid, again, if you have fluctuations in thyroid hormone during fertility, during the time that you're trying to get pregnant or during early pregnancy, it can really hurt the developing baby. Not only can variations in thyroid hormone keep one from ovulating and keep one from getting pregnant, it can be really disabling to the developing baby, and that can happen even in the first trimester. So that's one of the reasons why I always test thyroid hormones when someone, well, I say always, but I'll almost always test thyroid hormones when someone comes to see me for the first time because it is so important. Once we've addressed their thyroid, because I work in a holistic way, once we've addressed their thyroid, chances are we've addressed the other aspects of their endocrine system in harmony with looking at their thyroid. So they're going to be in a different place in terms of their fertility than they were if they just worked on their thyroid. So it's a little bit different paradigm.
Mm-hmm.
And I think, paradigm or perspective, the way that one sees the world or the way that one sees a specific subject like medicine has everything to do with this conversation, particularly with fertility and thyroid, because unless you've gone and sought out additional education, you are going to have the perspective that you were taught. So if you went to a traditional Western medical school, you're going to learn that perspective on thyroid health. And currently, my understanding, or at least until very recently, you look at the lab ranges, and most practitioners, if the patient's labs are within normal limits, they're not going to treat that person, even though that person might be tired. They're not going to give them thyroid hormone, and that's the only tool that they have. a person has to remember that when they go to an allopathic physician, that physician is possibly not going to want to put them on thyroid hormone if they don't see a problem with their labs, even if the person says that they're tired. So because they don't have the tools, they have a different set of tools. Whereas another person trained in a different paradigm will see things differently and have more tools to address the whole person rather than, say, one hormone either being in excess or in deficiency.
Yeah. Well, I think I really appreciate the paradigm of looking at the whole person and really getting at that concept that in order to be fertile, you actually have to have a healthy body. And it's something that people don't really think about kind of in the common discourse around fertility. You know, if you're having fertility issues, your doctor, you know, you end up getting IVF treatment or you end up getting some sort of medical treatment, which is, it's fantastic that all these options are available to us. But at some point, you know, you kind of have to put it together. You know, if a woman isn't fertile, that actually means something about her overall health.
Yes, in Oriental medicine, that would be, that's sort of a given. And in other types of medicine, that's not a given at all. So, one of the ways that they describe that, one diagnosis is called unexplained infertility. And that's a very frustrating diagnosis for people where all of their lab work looks quote unquote normal and their menstrual cycles are quote unquote normal and their imaging tests are normal, but they're not getting pregnant. And often I found when working with these women that often the answer is in what a blood test can't measure. There are a lot of things that blood tests can't measure. I really like blood tests. I really like imaging tests. I like information. I like diagnostics, but there are some things that can't be quantified in that way. So, for example, I had a patient come in yesterday and it was a great experience. It really made me laugh. She came in and she works in the Western medicine profession, and she came to see me. She was pregnant after an IVF cycle. She's in her first trimester and she's really sick. She has terrible morning sickness that doesn't just last in the morning, it lasts all the time. And she came to me and she said, and actually, someone had bought her a gift certificate to come see me because they wanted her to come see me for so long that they finally just paid for the appointment and gave her the gift certificate so that she would come in. And I think it was bought a long time ago. I don't know how long ago, but she had indicated that she'd had it for a long time. And so she didn't come before the IVF process. She didn't come during the IVF process, but she came when she was afraid that she couldn't function because of this incredible nausea. So, um, so I saw her and she was up on my table and I was doing acupuncture with her. And the reason I said it was so much fun is because, first of all, it's so much fun to treat someone who's never had acupuncture before, because it's like getting to relive that experience again myself of the first acupuncture treatment and to see it through their eyes. It's also really fun for me when I have Western practitioners as my patients because they have to be willing to accept a different paradigm than the one that they were taught, that it could possibly work. So she was up on my table and she said, darn it, it's working.
That's awesome.
And I laughed just, and she said, I don't want to offend you. And I said, you couldn't possibly offend me. I've heard a lot worse. I mean, it just really, she was such a sweet person. I said, couldn't possibly offend me. But it, because it was working, she now had to change her ideas about what medicine was. Because this weird process, this weird thing, acupuncture, was taking away her nausea when nothing else would. So further, I brought her up because I believe that she has the degree of nausea that she has now because when she got pregnant, her digestive system wasn't functioning very well. And she was not given a clear-cut reason why she couldn't get pregnant. I suspect that in the Chinese paradigm, she was having in part, difficulty in getting pregnant in part because her digestive system wasn't functioning optimally. So here she is. She got pregnant, which is wonderful and a miracle of Western treatment. However, is she healthy? No, she's not. So, and I think that the roots of that problem that she's having, the morning, quote unquote, morning sickness, which lasts 24 hours for her, was in her health before she ever got pregnant.
That's really profound, actually. And it really alludes to the perspective of just looking at it. You're really looking at things a lot differently to really kind of get that idea home. If you have a health issue, it follows you into pregnancy. It's not like pregnancy is this brand new state that exists outside of your body. So if you're not healthy before, of course, it's going to probably worsen, I would think, in some cases, or
It
be
either
exacerbated, maybe.
It often does. It often does. Some people feel fabulous during pregnancy. They feel great. They feel better than they felt before getting pregnant. And some people really don't feel that way, and they don't like the people who feel good. No, I'm just joking. I'm just
Well,
joking.
you
But
kind of have a point there, to be
they,
honest.
they really don't. They can't identify in that way at all, understandably, because the health issues that followed them into the event of pregnancy stay with them. So again, it's a process versus event perspective, right? The event is pregnancy, but it's not a whole new state. It came from your health prior to getting pregnant.
Hmm. Well, I could continue talking to you all night, um, because I'm having so much fun chatting about these topics. So I'll bring the interview to a close. I have a few final questions that I'll ask at the end here. So to kind of wrap up everything that we talked about before I go into my final kind of few questions, maybe you could just talk briefly about the Chinese medicine perspective on the importance of overall menstrual cycle health.
Um, well, when you ask that question, so many things come to mind, but yet I feel like I can distill it by coming back to the fact that when I was in China studying for my doctorate and I was in the hospitals, the gynecology hospitals in China, that everybody took responsibility for their health in some way and that they were responsible for their own medical records. They brought their own chart and they took their BBT and they brought that BBT to the practitioner. So the health of their menstrual cycle and how it was reflected in their basal body temperature chart was a subject at every meeting with their physician. Um, yeah, I think that's the most probably concise answer I could give you. I could give you many, but that's probably the most concise.
Yeah. And even
That
though you mentioned that at the beginning of the podcast, to hear you say that again, it still gives me this moment of just, wow. In one of the interviews, I've been bringing it up here and there, but one of the interviews that I did recently was with Dr. Danielle Miller, and she's actually a medical doctor who trained in NAPRO technology. And so she was actively trained to use a woman's menstrual cycle chart to as a diagnostic tool and to inform diagnostic testing and when to test and what to test for and all those types of things. And it was like I was listening to this amazing alternate universe that I want to be part of. And so when you're describing your experience in China, I feel the same way because I really, after all of these years, after my exposure to the fertility awareness method, and I know before we started the interview, you had asked me, what prompted me to start my podcast and the website. And really, in my perfect world, this would just be what happens because it has the potential to be that important. It is that important in helping to determine a woman's health status and helping a woman to figure out her fertility issues is just another tool that is not being utilized. And so yeah, I really, I'm still kind of amazed at that. Now I want to go to China.
It was really an amazing it was an amazing experience to sit and watch. And I actually write about it in the very beginning of my book because it was that powerful for me. I write a vignette about what it was like to be in the gynecology hospital in China, um, and observe Chinese gynecologists. But they would seamlessly incorporate Chinese and Western medicine in a way that I couldn't explain. That's even difficult for me to comprehend. But a person would bring in their BBT chart, and the physician would take their pulse and look at their tongue and ask them some questions. And maybe they would make an herbal formula at that point, or maybe they would send them downstairs for an ultrasound, or maybe they would send them to go get their blood work. And then they would get the ultrasound report and the blood work back the same day. The patient wouldn't leave the hospital. It would be a day-long event. But they would get the results that day. They'd come back and see them. And then the treatment would be given. So it was a piece, the basal body temperature charting was a piece of, it was fully integrated, as well as other Western diagnostic techniques, into the evaluation of a patient. And this is California is a very different world than Guangzhou, China, but uh, it was a very powerful experience, and that's what I really try to, in my own way, endeavor to do in my own practice, is have that kind of seamless integration of different kinds of diagnostics.
Amazing. Something to strive to in the future.
Absolutely.
Okay, so final questions of the day. What would you say is the biggest myth about fertility that you'd like to see corrected?
It's all the woman's fault.
Like the man doesn't have a contribution to make.
Yeah, that really is that is the absolute biggest myth. Um, I mean, I could quote statistics that I'm sure you and your listeners are familiar with, but at least a third of the time, the primary reason that a couple is not getting pregnant lies with the male partner.
Yep. Yeah, well said. And what is the biggest myth about the fertility awareness method that you'd like to see corrected?
That's a good question. I think it would be really wonderful to, because I have a fertility centered practice, and that's the those are the patients that I talk to about the fertility awareness method. And the biggest myth about it that I would love to see corrected is that it's an evaluation of, women can get very, I don't know what the word is, very interested in the slightest variation in their BBT chart, and they can forget that we're looking at a process, not an event. So a BBT chart, your entire fertile existence does not hang on if it takes 2 days or 3 days for your temperature to rise after ovulation. So it can be very stressful for people. And if you look at it as a way to learn about yourself and learn about your health, it loses the stress, it loses the power, and it becomes simply a tool. It just simply becomes an informational tool rather than a constant reminder that you're not pregnant, or something to be worried about if your temperature is going to be a half a degree higher because you got to sleep 3 hours later the night before.
I love that you said that. I love that you said that because I find it to be very interesting that exactly what you said. Women get hung up on the slightest change, some sort of random thing, because there's always random things that happen, instead of because sometimes my answer in a lot of cases for questions like, why did my temperature go up this day or whatever, would be wait 3 days, wait 5 days, wait 2 charts.
Right.
And so I love that she said that, because it's a process and it's not defined. I love what you said. Your whole fertility is not hanging in the balance of what happened on one day of your cycle charting. It's okay. Love it. Okay, final question of the day. So what advice would you give to a woman who's listening, who is currently on hormonal birth control, doesn't want a baby right now, but knows that she wants to plan to start a family maybe within the next 2 to 3 years?
Stop it.
Bam.
Yeah, it sometimes it's that simple. Use an alternate method of birth control, a barrier method. Ideally condoms, although there's no one great method of birth control in terms of great, meaning that it's easy to use and you don't have to think about it and he's happy with it, and it just doesn't exist. But stop manipulating your hormones artificially and start charting and see what your body is like at its natural state. So take your body back to its natural rhythm and find out what that is. And that might take 6 months. It might take a year after you get off the pill. So if you're on the pill and you're thinking about having a family in 2 years, it's not too early to get off the pill and invest in some condoms.
Love it. Well, thank you so much for being here today, Maureen. I absolutely loved our conversation, and honestly, I could continue to talk to you and just keep asking you questions because I had such a great time interviewing you. So before we go today, where can our listeners go to find more information about you, what you do, if they happen to be in the Santa Cruz area, how they can come and see you?
Oh, well, thank you for asking. So if somebody's interested in my book, they can find out more about it at yourfertilityprogram.com. That's the name of my book, and it's also on Amazon and Barnes & Noble, etc. It's on the web. It's available in a downloadable format as well as in good old-fashioned paperback. If they want to know more about me and my private practice, they could visit acupuncturesantacruz.net. And of course, those 2 sites are linked. So if someone is in the Santa Cruz area or has a friend that they want to buy a gift certificate for, somehow to coerce and to come see me. Anyway, that's how they will go more about me.
Awesome. Well, if you're listening to this on the go, just come to the show notes page and I'll link both of those websites as well as the book and anything else that we talked about today on the website. So thanks again, Maureen. I had a great time chatting with you.
Oh, me too. Thank you so much.
Thank you for listening. I hope you enjoyed my interview with Dr. Maureen Rozenn. I had a great time recording it, and I found it to be so informative. Don't forget to check out her book, Your Fertility Program. Just check out the show notes page, and you'll find all the links to it. If you enjoyed today's show, please share it with a friend. You can always find me on Facebook at facebook.com/fertilityfridays with an S. You can find me on Twitter at Fertile Friday, or you can stop by the blog and leave a comment in the show notes for today's episode, which you'll find at fertilityfriday.com/41. So just the number 41. And of course, if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. Of course, leave an honest review. I appreciate all of your feedback and all of your comments. And as I've mentioned before, if you are wanting to join the Fertility Friday Facebook group, you can find that at fertilityfriday.com/community, and you'll be redirected to the group. So as always, until next time, be well and happy charting.